Because DBT's foundation is mindfulness, mindful behavior, mindful thinking, mindful training helps a person, especially with chronic illnesses that there is no cure or treatment, for just being able to be in the present moment. Thinking about the pain that one might endure in the future and bringing it into the present moment increases the pain that one experiences right now, when the pain hasn't happened from the future. Just like it is about focusing on the past. Bringing pain from the past into the present just increases your pain, your ordinary average pain, although extremely painful, to be higher. And it's not effective. So my name is Rachel Blogg, and I'm a licensed clinical social worker. I'm intensively trained by behavioral tech. It's a specific type of cognitive behavioral therapy that was developed originally by Marsha Linehan back in the 1990s to help people who originally had a diagnosis of borderline personality disorder. However, over the years, it has been found that it is actually very beneficial and very effective for other types of mental illnesses. DBT has some CBT in it. CBT focuses on the interactions of people's thoughts, feelings, and behaviors, and the interactions of them together and how they affect each other. And so with CBT, they believe that if you get them to change their thinking, they can react differently to a situation. Whereas DBT also does focus on that. However, the emphasis within DBT is also on emotion regulation, being mindful, and learning how to change behavioral patterns that are ineffective for them to have a life worth living. When we work with people who are depressed or who have mental illnesses or have chronic illnesses, if they feel that their life is not worth living, which every life is worth living, okay, so let's understand that. However, within DBT, we believe that if people can work towards what they believe is their life worth living, then it's going to be harder for them to choose an out. They're going to want to stay around, and they're going to have some tangible goals that they can reach towards the life worth living that they want. And so we focus within DBT on the life worth living goals that they have and what gets in the way of those goals. I decided to go into doing DBT when I first went into private practice, which was over 23 years ago. It was a concrete, tangible, had been empirically studied. Data has shown that it has been very effective with changing people's behaviors. And so I happen to really like having the ability to teach skills that are tangible. For a lot of people, they need tangible skills, as opposed to talk therapy, which is also great. It's just not effective for every single population. Within DBT, there's also what we call a skill called radical acceptance, and that is being able to accept the reality of how things are at this moment, where things are. It doesn't mean that we like it at all. There's so many things in life that we have to accept that we don't like and we can't change. And so by being able to incorporate mindfulness and radical acceptance, it allows you to decrease the pain of the present moment. Being able to be in this present moment is just being present to what's happening right now. This moment, especially with people who have chronic illnesses, chronic pain, the pain may not be as bad right now. So this moment, I just have to get through this pain. Also, if it's really excruciating, a person just has to get through that moment. By thinking about the next few moments takes away from this moment. Accepting any type of diagnosis is really difficult, and I think a lot of people get confused when they hear the word acceptance. They think, oh, I'm accepting it, I'm liking it, I'm okay with it. And that's not what we mean. We're saying that it is what it is. Within radical acceptance, within DBT, this is what was handed to a person. And they don't have to agree with it, they don't have to like it, right? But by accepting it, it decreases their suffering. It decreases the pain that they are experiencing emotionally, maybe physically even. I might have to accept something 1,000 times in a minute, right? So somebody who gets a diagnosis of MS or a chronic illness, might have to truly accept that over and over and over until it becomes part of their core. Pain is inevitable. Whether we have a chronic illness or we have a mental illness, everybody experiences pain. So what we believe in pain, within pain and DBT, is by accepting what is, that makes that pain tolerable, okay? So pain is the acceptance of the situation, which is uncomfortable, we don't like it, but that pain is tolerable. Suffering, which I say is optional, is when we're not accepting. We are refusing to accept the reality as is, right? So I can make things worse. If I'm refusing to accept what is, and I'm not if I'm not accepting that I have this chronic illness, it's going to prevent me probably from going to the doctors, to seeing what I can do to make my life better at this moment. Dialectical thinking is the synthesis, the integration of opposites. So two things that can appear to be completely opposite, both can exist and both be true at the same time. A dialect with a chronic illness is maybe like, I have this chronic illness, it will never change, and I can enjoy my family time, this moment, right now. An example I like to use that's, whether like in relationships, right? I can love a person and dislike them at the same time. The same moment, they both can exist at the exact same time. DBT is all about the synthesis of polar opposites. And so that I call that the gray zone, right? We talk about the wise mind. And so the black and white thinking keeps people exactly that way. They believe it's this or that, right? And we don't believe that. We say it can be this and that. So going based on your example, I was a competitive cyclist and I can no longer be a competitive cyclist, so therefore I should just quit and give up. That can become problematic, because if that's something that a person loves to do, right, accepting that they may not be able to compete anymore at that level doesn't equal that they can't still engage in something related to that sport. And so when you have an all or nothing thinking, it doesn't allow people to see that there can be those two polar opposite things can both exist at the exact same time. So for me specifically, as an intensively trained DBT therapist, we have what we call the 4 pre-treatment sessions. And the first one is a 90-minute session, and then during that time I talk about what brings them here, what is DBT, I educate them on the biosocial theory if they need to be talked about, and then over the next 3 to 4 sessions we talk about what their goals are and what their target behaviors are going to be, what they commit to doing, to not acting on self-harm behaviors or suicidal thinking, and we get a commitment prior to them starting the actual program with me. We use a skill called opposite to emotion action, which means that yes, your depression might fit the facts, meaning I've just gotten this diagnosis, it's not, a good one, I'm not happy about it, and I feel really sad about it. However, to act on that and be depressed and stay in the room and stay, in your bed the whole time and just not take care of yourself would not be effective. And so when we talk about how to work through depression, we say, let's look at some behavioral activation, get going. Opposite action is doing the opposite of what that emotion depression wants you to do. And and how I'm saying it so easily and off the cuff right now, it's not easy. I'm not saying it's easy for anybody. It takes a lot of like they have to dig deep, and they're gonna have to find like a lot of courage to just get up and go. As painful as it's gonna be, but they won't be suffering. And so by doing things that might make them feel better, right? Even if you're home and you're sad and you feel depressed, and maybe, again, the sadness is justified, right? But it's not effective because you don't want to feel that way anymore, then like watching America's Funniest Videos or something that's opposite to that emotion would help alleviate that depression. I believe that Adherent DBT provides, the skills coaching, the phone coaching, the skills groups, the individual therapy, and the consultation team for the therapist. That, like, I'm on a consultation team and I lead a consultation team as well. That is therapy for the therapist to help us make sure we're doing the best that we can and being the best therapist for our clients. And if they're stuck, what are we doing? You know, so can somebody learn these skills? I believe they can. With a therapist, without a therapist, I believe they can. It's based on the data. You know, you are with DBT trained therapists, so you wouldn't get all the things that you would, a person who would be in my program, in individuals, such as like the behavioral chain analysis or the diary cards. But in terms of learning skills for somebody who really wants to learn those skills, I believe they can do it online. And they can read some books and some, you know, resources online, self-help. There's a reason we have self-help books, because a lot of people can't get to therapists and a lot of people don't have the resources for that.